Hello everybody, I'm Dr. David Feldman. I'm the gastroenterologist for the consumer of healthy medical care. And today we're going to talk about gastroesophageal reflux disease and what do you do if you get heartburn during the night. Okay, so what are your choices? You get heartburn, you wake up, it's 4 o'clock in the morning. Do you take an antacid? Okay, do you take an antacid? It's 4 o'clock in the morning. How about an H2 blocker? Or your third and final choice is a PPI. Okay, so what do you do? How do you get the fastest relief and the most bang for your buck? Well, it's going to be antacids. So what are your choices of antacids? Well, you have Mylanta, Maalox, Gaviscon, Rolaids, Tums, and store-bought brands. Well, my friends, what I found is when I go out there to the pharmacy, you can't find Mylanta or Maalox because they now stock only the store-made brands. So this is what I found. So when you go out there, you have a choice of the store brand, the antacid liquid suspension, or the chewable tablet. These are your antacids that are available in the pharmacy, in the chain pharmacy that is at least. They have their store brand. So the store brand is basically the same ingredients as Mylanta or Maalox, which is magnesium hydroxide and aluminum hydroxide combination. Now let me just warn you that some of them also have simethicone. And simethicone is a silicone-based product, and you should not take it if you are pregnant or breastfeeding. So, what's your other choice? Your other choice is Gaviscon. So Gaviscon comes in the brand. It's either a chewable tablet or a liquid. And let me remind you, when you take the chewable tablets, make sure it's followed by a glass of water because they work best if you take them, the chewable ones, with water, and the suspension, you don't need water. Okay, so these are going to give you your most immediate relief, but the problem is they're short acting. So their action will last about an hour or two, and then you may need something else. But at least you get through the night with your antacid. Now, what's the difference in antacids? Well, as I mentioned, the Mylanta, Maalox, and store-bought brand copies are magnesium hydroxide and aluminum hydroxide. And they cost a little bit less than the Gaviscon. So why would you pay a little bit more for the Gaviscon? Well, the Gaviscon has a slightly different action. Okay, Gaviscon, chewable, and the suspension both contain alginic acid. Now here's the problem, folks. In the United States, the alginic acid, or alginate, is listed as an inactive ingredient. In Europe, it's the most active ingredient. And we know that it is also the most active ingredient in the United States, but it's listed as inactive because the pharmaceutical companies have not gotten the FDA approval to list them as an active ingredient, and they're not going to do that. So is it worth it to pay more for that inactive ingredient? Well, I'm going to tell you yes. And you should pay a little bit more. It's about $1 more for either the chewable or the suspension of the Gaviscon, and that's because they have an additional mechanism of action with the alginate along with magnesium and aluminum, and that additional inactive ingredient is actually the most fabulous thing about the Gaviscon, and that's it forms a raft. Yes, it's called a raft. It's where the alginate combines with the acid in your stomach, and it goes to the top of your stomach, and it forms a seal, and it prevents acid reflux. So I think it's worth the extra money to purchase the more expensive Gaviscon. And the alginate is only found in Gaviscon, and it's listed again as an inactive ingredient for not a good explanation, but in Europe it's the most active ingredient. So let me just talk about who shouldn't take antacids. Well, Rolaids and Tums are also antacids. They have only calcium in them, and they're a good calcium source, but they're not very good at being an antacid, and that's because they buffer the acid and they last a short time, and you will find that you'll need more Tums or Rolaids in a very short period of time. So I think you're better off either taking the magnesium and aluminum hydroxide or the Gaviscon, which costs a little bit more, which has an additional mechanism of action. So who shouldn't take it? Well, all of these products are only approved in people who are over 12 years old. In pregnancy, you can use Gaviscon. You cannot use the calcium products in pregnancy. So that's it for today, folks, and I'll be back with my next video soon. Thanks, bye.